Hello, my name is Chris. I'm a retired Canadian pharmacist. Welcome to this 7-part series titled What Every Pharmacist in Canada Needs to Know About the Design and Teaching of Doctor of Pharmacy degree programs. This is Part 6, Technology Mediated Learning. Spoken throughout this series about criticisms in the literature regarding entry to practice Doctor of Pharmacy degree programs. Sometimes the problem is not so much an educational method, but how that method is used. And I'll try and explain both beneficial, but on the other side, negative aspects of multiple choice questions. Multiple choice question exams, high stakes, remain a dominant form of teaching in Canadian colleges and schools of pharmacy. Strategies students use to prepare for high-stakes end-of-semester multiple-choice question exams include cramming. That's something we would have all done ourselves in our own time. Very successful in helping the students to pass exams, but it comes with two costs. One, the knowledge is in short-term memory and doesn't transfer into long-term. As such, the knowledge learned is soon lost. The learn, test, forget mentality. It's as well, sometimes it will cause students to devalue other forms of assessment. As such, a student under the pressure of an upcoming multiple choice question exam may devalue other forms of assessment. It's important to understand students' mindsets. Many students' self-esteem may at least be partially based on their ability to successfully pass high-stakes multiple-choice question exams. They wouldn't be in pharmacy school if they were unsuccessful in passing high-stakes multiple-choice question exams. Their self-esteem will be built on it, and in particular, if they outperform their peers in those exams. As I say, they may act unprofessionally if faced with other forms of assessment. I spoke about students bringing their stories back to school in small group discussion classes and being challenged with identifying and acting on learning opportunities. In that setting, a student struggling may have their self-esteem damaged and may act unprofessionally. To address that problem, some internationally renowned educational institutions have abandoned high-stakes multiple-choice question exams in favor of practice-based assessment. Their philosophy is that it's illogical to have two sets of educational methods, one set required for in-school teaching, and then as the students graduate and go off to their practice careers, having them use a totally different set of educational methods that has not been taught in the program the students have come from. Sense that the educational methods are needed by graduates for their career-long continuous professional development should be the same educational methods used within the initial training of students, regardless of discipline. Choice questions can be used to drive knowledge from short into long-term memory. I described the integrated use of teaching technology-mediated learning with experiential education. A student in a practice site coming across somebody with diabetes and being motivated to learn about endocrinology and needing a catalogue of online learning modules accessible to them at any time and in any order so that they can match their practice-based education with their didactic education. It's crucial that those online learning modules have large numbers of multiple choice questions. Self-testing. Self-testing is a very effective form of driving knowledge from short into long-term memory. and as such, all online modules should have large numbers of self-test questions. One that self-testing should be used to its maximal potential. Knowledge learned in one semester is going to be important in all semesters and throughout somebody's career. So the concept of self-testing material learned in one semester throughout the remainder of the student's school or college career comes down to repackaging old questions, putting in new ones, so that students can be continuously challenged with new questions throughout their pharmacy school careers. Important too, I think, for faculty. Faculty typically teach in a single semester and as such focus on students from that semester and then forget about them. They're not interested in how students retain their knowledge in subsequent semesters and going out into their careers. If students are self-testing on their material throughout the remainder of their program, then it benefits that faculty member if they see how their knowledge subject matter is being retained by students throughout the duration of the student's pharmacy school career. Self-testing can be improved in other ways too. So for example, in a typical pharmacist's daily life, they will be jumping from one set of knowledge to a different set of knowledge to multiple more sets of knowledge. Pharmacist jumping from a billing problem to counseling a patient on a new prescription to going into the non-prescription aisles to help a new parent deal with a teething baby or whatever it's going to be. This concept of jumping from one subject matter to another, to another, to another is another very effective form of driving knowledge from short into long-term memory. So you can picture a school of pharmacy creating mini-quizzes, online mini-quizzes, but with subject matter drawn from across the spectrum of the pharmacy curriculum, the basic clinical and humanistic sciences, trying to match that daily life of a pharmacist needing to jump from one set of knowledge to a completely different set of knowledge, to a third different set of knowledge, and so on. The same principle applies in the small group discussions that have been spoken about earlier. If 6 or 8 students are bringing their stories back into a small group discussion, then the 6 or 8 stories are going to be jumping backwards and forwards across the spectrum of the pharmacy curriculum. And as such, that jumping about from one knowledge base to a different set of knowledge, to a third set of knowledge, and so forth, another very effective way when done on a repeated basis to drive knowledge from short into long-term memory. Throughout this series, I have been giving quotes from the literature, and I'll continue with one quote here. And as before, to make sure I don't misspeak, I will read out the quote. Again, Pharmacist writing in the literature, quote, "Pharmd curricula that crowd out good behaviors and encourage cheating, shortcuts, and unethical behavior." Brief mention of the upcoming part 7, the last part in this series. Simulation comes in many different shapes, sizes, and I will do my best to give examples of that in the upcoming part 7, as well as an overall summary of this 7-part series. I'll ask the same question that I've asked at the end of all of the earlier parts to this series, asking you to cast your minds back to when you were in pharmacy school and to ask yourselves whether or not you would have benefited if you had been given the opportunity on a frequent and regular basis throughout your program to spend time in practice sites with your sleeves rolled up. If the answer to that is yes, then I will ask you to view all parts of this series. I'll ask you to talk to your colleagues, talk to your local, provincial, territorial, national pharmacy organizations, talk to your local pharmacy school, talk to the accrediting body, talk to anybody who will be listening, might listen, but with the context of driving change in accreditation standards, so that pharmacy school accreditation standards reflect evidence-based educational methods recommended for Pharmd entry to practice Pharmd programs. Thanks for watching. Your questions, comments and requests for supporting documentation are welcome.